My name's Avni Trivedi. I'm an osteopath and I help women enjoy their pregnancy. I practice at the Third Space, which is in Piccadilly in London, and most of my clientele tend to be professional women. They're often working really late in their pregnancy, working long hours, often very active in their leisure time but used to doing more competitive activity. So I work to help them to get more body aware and really start to listen to themselves, slow down when they need to, and also make the most out of their pregnancy. I also help people understand their choices that they have during their pregnancy and their labour so that they can have an experience that they choose to. I've been an osteopath for coming up to 8 years, and also various other complementary therapies which I use with my osteopathy. I also have a master's in paediatric osteopathy, where I trained at the Osteopathic Centre for Children, which is internationally known. It's the place that all osteopaths wanting to specialise in the field come to. And most recently I became a doula, so someone who supports women during the labour. I felt that when I was treating babies as an osteopath, so many had had birth trauma, and I got interested in what happens during the birth that causes these traumas. And so I started to work with women in that respect. My specific areas are helping women during their pregnancy, so right from the first trimester to preparing for birth and postnatally. Anything to do with their physical ailments, aches and pains, carpal tunnel syndrome, heartburn, morning sickness, also the emotional ups and downs, how to have a more even keel during the pregnancy, and the baby's development for the first year. With babies, I tend to treat and deal with issues of digestion, irritable babies, unsettled babies, crying issues, feeding issues. I love seeing a mother and baby that maybe aren't so connected or so bonded just shift with a few tips or a good treatment, and start to actually listen to each other's needs much more. So when a mother and baby is that much more connected, it's really rewarding. And also seeing a couple go from being a couple to being parents, and that transition it takes in their relationship, and the amount that they might have to lean on each other when they wouldn't have had to before and things. It's quite a private time and a time of such change, so it's a real privilege to be part of it. At the moment, I'm particularly interested in women in the workplace, because I think that companies have it handled when it comes to the legal issues, but they're not really looking from a well-being perspective. And even if someone's going to a pregnancy yoga class or swimming or things that would help her health, she's in the workplace more than she is anywhere else. So one thing I'm really looking for is the best practice, and that's something that I'm very happy to advise on, how to really manage the day at work.